and welcome. Thank you for tuning in to Maternity Minute. My name's Christina Edgar, Labor and Delivery RN here at HonorHealth Scouts O'Shea Medical Center. Here's this week's tip. Hey guys, welcome back to the Maternity Minute. Today we're going to talk about breast cancer awareness as well as fertility preservation. Today I have Dr. Lipskind here and I have Brittany here to talk a little bit more about breast cancer and ways to preserve your fertility. She's a former HonorHealth patient and a breast cancer survivor. She is going to talk a little bit about her story. So Brittany, how old were you when you were diagnosed with breast cancer?
So I was first diagnosed at the age of 29,
Okay.
and so that it's kind of funny because I think every nurse has said, "Oh my gosh, you're so young. How did you find it?" And it was a hard lump that I had felt when I had gotten the diagnosis at first. The HonorHealth nurse navigator, she said and wrote on a sticky note, "This is if you do anything today, this is the phone number that you need to call." And it happened to be Shane's phone number.
So did you, in regards to future fertility, did you have concerns about going that route, or were you at 29, was this just not what you were thinking?
Yeah, no, my husband and I had not had the discussion. We weren't there yet in our lives, and so it was kind of a discussion that needed to happen really quick. And so with meeting with Shane, he said, "Let's sit down, let's talk in my office," and that's what we did. We sat down on his couch and he explained to us what our options were, and we were able to kind of take a step back and discuss if this was in the future for us. And I think it was in the future for us, more as an option of down the road, because it's chemo that can actually shut down your ovaries. I don't know. But for us it was, we want to be able to have this as an option later.
And did you have any difficulty seeking the fertility preservation in regards to also getting your treatment? Like, was there a delay?
Yeah, so when we started the discussion of fertility preservation, it does delay the start of chemo a little bit, just because you need to make sure that you get through, your preservation cycle and stuff that you need to get done first. But it wasn't like a huge amount of time, so it does delay it a little bit.
Thank you so much for coming today and sharing with us. And she's actually expecting 2 twin boys in January, so this is really exciting. So Dr. Lipskind, why don't you just touch base on exactly what this is and the process?
Right, so the biggest concern with respect to breast cancer and fertility is that women are very often going to be asked to delay having children, or they may have to receive chemotherapy. And one of the most important things for natural fertility is a woman's age. And so if women are being diagnosed in their late 20s or their early 30s, taking time off to do treatment and then waiting to begin their families can push them to a point where it's very difficult for them to have children on their own, and certainly without medical assistance. The other concern is the chemotherapy itself, which, as Brittany kind of alluded to, it can diminish the quantity and quality of eggs that a woman has left, because that is a finite number that she's born with, and it decreases naturally over time, but it can really take a big hit with chemotherapy, to the point that some women will go into premature menopause and never have return of their natural function. And the closer they are to natural age of menopause, the greater that chance is. So when we meet somebody who's been diagnosed with cancer, we want to talk to them about these risks, and we want to offer them options for preserving their fertility, which usually would include stimulation of the ovaries to harvest and freeze eggs, or in some cases to actually fertilize those eggs at the time that they're collected and create embryos that we would also freeze. So the whole point of preserving eggs or embryos is that we're getting them out, hopefully before there's been any exposure to the toxic effects of the chemotherapy. So these eggs and embryos, they're going to be safely frozen or cryopreserved and stored in very, very cold cryostorage tanks in liquid nitrogen. But these can stay frozen, we've seen, for years. Probably there's no practical limit to how long they can stay frozen for. And then when the patient is, past her cancer diagnosis, she is cancer-free, her oncologist says that it's safe for her to achieve a pregnancy, we can thaw an embryo and transfer that to her uterus to establish pregnancy, even if her ovarian function is completely stopped. Or if we frozen eggs, we can thaw and fertilize them to make embryos for the transfer at that time as well. Women that are more than a year, and usually we're recommending to wait 2 years past their cancer diagnosis, can safely become pregnant as long as there have been no signs that the cancer is coming back, and we don't see any decrease in their survival rates or any increased risk that the cancer will come back.